Hey, what's going on, guys? This is Coach Ben with M.B.S. I'm glad you joined me today. So today's video is going to be a slightly different format. Rather than getting some nocturnal miles or in the studio, I am currently on the road. So today's video topic is going to be on the rice method. Now, this is some pretty useful, common first aid type of knowledge, especially whenever it comes to smaller injuries, bumps, bruises, sprains, strains, and similar type of injuries. So the acronym for the RICE method is broken up into individual parts, and this is generally what is the most appropriate for smaller injuries, whether that be an injury in the gym or a rolled ankle, sprained ankle, those kinds of things. So basically, the first acronym for RICE, being the R, is going to be rest. So pretty common knowledge, common sense. Whenever you have a particular injury, whether that be a bump, bruise, strain, sprain, rest is always going to be the best thing for you and enable you to have the most speedy recovery. So the second, which would be the I, is ice/ibuprofen. So this is useful for the inflammatory response, typically to keep swelling down, try to reduce the swelling of the injury and the micro trauma of the result of the inflammatory response from the swelling. So, just as a side note for the ice, you want to make sure that you're not putting the ice or the Ziploc bag or whatever your ice method is directly onto the skin, because that can actually cause some thermal burns. So what you want to do is have like a very thin cloth, kind of like a pillowcase, or a very thin cloth just as a sort of a buffer barrier, rather than just putting the ice bag directly on the skin. You can do it in short intervals or in short durations, but it's just not ideal. You have a higher chance of irritating your skin and possibly causing a very minor ice type of burn. So the second would be ibuprofen, and this serves in a similar function as the ice, just in a different mechanism through the medication of trying to negate the adverse effects of that inflammatory response. And as a side note for the ice, what you want to do is have the ice do your ice treatments in the affected area, for about 15-minute intervals. You want to do like 15 minutes on, 15 off, rinse and repeat. You can do that a couple of times, and you can also do that multiple times a day. There isn't really a definitive limit for that, so just within reason. You could do 2 or 3 rounds in the morning, 2 or 3 rounds in the evening and before bed, vice versa. So the C is compression. So whenever you have a swollen ankle or wrist or whatever other kind of injury, you're going to want to get some elastic ACE pressure bandage. Pretty easy to come by. You can find it in pharmacies, general stores, almost anywhere. So you want to give a nice snug amount of compression, and this is going to also try and negate that extra swelling, that extra inflammatory response. So it's pretty self-explanatory. Obviously, do not, have compression so tight to where it's cutting off circulation. You want it nice and snug, but not to the point where you can't feel your toes or fingers or, that kind of thing. And the last one, which is E, would stand for elevation. So, the most common application for this would be like a sprained ankle. You want to make sure to be doing all of these things simultaneously and as much as you can throughout the day to help speed up that recovery process. And the elevation also allows to minimize swelling or reduce swelling as much as possible through the interstitial spaces in the cells of the affected area. There's going to be a lot of extra fluid there from that inflammatory response. So by elevating your foot or whatever the area is, that goes along with all of the other strategies that you're employing to try to reduce the swelling as much as possible and reduce the inflammation as much as possible, because the more something swells and becomes inflamed and irritated, the longer it's going to take to recover. And typically in injuries like the ones that we're talking about, the sprains and strains and bumps and bruises, usually this ranges anywhere from like 2 to 4 weeks or so. But obviously the more that you can apply these concepts, the quicker your recovery time should be, and you should be back at it again. Anyway, that's all I got for today, guys. I really appreciate your time, and I will see you